Broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Michelle Smith with Texas Action for Healthy Kids. Welcome to our webinar, SHACs in Action, award-winning School Health Advisory Council models. So we're excited to have a couple of our great, outstanding schools present today. And just so you know a little bit more about the organizations that work with us on this, we have a collaboration with the YMCA, It's Time Texas, and all the others that are on this screen to help support school health advisory councils. The Department of State Health Services formerly had programs that supported school health advisory councils, and they still provide some resources. But Action for Healthy Kids has become kind of the go-to organization for school health advisory council trainings and kind of the umbrella group that works with all these other organizations to bring the information out to school districts. Logistics for the day: your phone or computer speakers are muted, and if you are not hearing clearly on your phone, you can, or on your computer, you can always call and listen in. If you have questions, you should have a control panel on the right side of your computer screen, which will have a question box. Just submit your questions in there, and we will do clarifying questions after each speaker. And then at the end, we will hopefully have a little Q&A time where you can ask any other questions that you might have. We are recording this webinar, and it will be posted on YouTube. We'll send a link as well as a PDF file of the slides after the webinar, as well as the Whisk blank template, which we sent out yesterday. That template is also in the handout box. If you look in your control panel, if you didn't get a chance to download it and print it yesterday, there's a JPEG in the handout box that you can print today. Some people would like to have CEU credits or certificates for this webinar. They are available on request. So you would email webinar@itstimetexas.org. And we will also put that in the follow-up email as well. I'm hoping that if you're on this call that you know what a School Health Advisory Council is. We all know that healthier students are better learners, and the School Health Advisory Councils are district level councils that assist the district in ensuring that local community values are reflected in a district's health education instruction. That's their primary purpose. That has been expanded on over the past 15 years to include anything that basically relates to student health. They are a mandated advisory council for each district. They are appointed by the school board. They should consist of 50% or more of parents, parents who are not employed by the school district. Should be a major part of those. It's a great opportunity to share the importance of health to children's academic success with school districts and with boards. They are mandated, they are mandated to review all health-related curriculum and make recommendations on health-related topics. And it's up to each school district to identify how they want to approach this. What are the critical areas for your district that need to be focused on? But they should be using the coordinated school health or whole child models to guide them on those selections. So I'm going to turn things over to Ashley Hearn, one of our partners with It's Time Texas, and she is going to share a little information on some award-winning SHACs and get us started today. Ashley?
Hi, everyone. My name is Ashley Hearn, and as Michelle said, I am with It's Time Texas. So today's webinar topic is award-winning SHAC models. And so each year we give out awards to 5 SHACs for the work that they do within their school districts in promoting health. And so today we have a couple of our 2017 award winners who will be presenting about their SHACs and the work that they've been doing in their school districts. I also wanted to go ahead and just let everybody know that we will be opening our applications for the 2018 awards within the next couple of weeks. So keep an eye out in your emails and on the website for more information about that coming soon. So with that, I will go ahead and turn the time over to McKaylee Smith, who is the PE Health and Wellness Coordinator at Comal ISD. And as I mentioned, they are one of our 2017 winners.
All right, well, thank you. Thanks for the opportunity for having us. We were certainly honored to receive the award this year, and certainly any success that we have had can be attributed to the support of organizations like It's Time Texas and Action for Healthy Kids. So we appreciate this opportunity. So a little bit about Comal ISD. We are a fast growth district. We have a little over 23,000 students, 30% eco-dis, a little over 1,800 employees. We're geographically large, span about 589 square miles and 5 counties. So our SHAC last school year and this school year really separated our focus into 5 areas. So we have fitness and physical activity, school gardens and nutrition, mental health and safe schools, Comal Fit, which is our Comal ISD wellness program, and then campus SHACs. So really the foundation for a lot of success that we have had can be attributed to a couple of things. The first is the work that our SHAC was able to put forth to create and present an updated district wellness policy, which was approved by our Board of Trustees in 2016. And I believe we were successful in the policy update because of our use of data and research, as well as relying on other model policy resources. So this really served as the springboard for some of the things I'm going to talk about today. One of the other things that I can contribute our success to as a SHAC is collaboration and support of other districts who have been doing the things we wanted to be doing with extreme success. So Spring Branch ISD, as many of you know and will hear from, is certainly one of those districts. So I would encourage you to not be afraid to find people and programs who are experiencing success and emulate that success. And with that being said, I also encourage you to share your success with others, because we are all on the same team and fighting the good fight together, so to speak. So I see the slides now, so it's the next couple of slides. If we can transition, there we go, one more. Awesome, okay. So a few things that we have been successful in this year is, and it's a great segue from collaborating with your peers, because the campus SHAC model is one that we got directly from Spring Branch ISD, and we integrated it into our updated wellness policy, and just have been continuing to grow year after year with our campus school health advisory councils. So with the updated wellness policy and the focus of national policy shifting more towards accountability and tracking progress towards wellness goals, we were able to implement SHACs and wellness champions on all of our campuses. So we wrote into policy that the SHAC chair must be a parent, and that the group must consist of at least 3 participants to include that wellness champion. But principals are certainly encouraged to include more through the campus SHAC roster. Each campus SHAC works to have a minimum of 2 coordinated school health events per year, and are held accountable for demonstrating progress towards their goals via an end-of-year assessment. So these campus wellness groups have really increased our parental involvement and allowed us to stay better connected and really streamline our SHAC communications, which is particularly beneficial for us being a very geographically large district. Next slide. So like I said, each campus SHAC is held accountable for completing an end-of-year assessment. We've partnered with the Alliance for Healthier Generation for the use of their online assessment and action plan tool and award opportunities. And there was a study that was recently presented at one of our PE and health coordinators meetings on what makes a successful SHAC. And one of the findings was the importance of SHAC meetings not just being show and tell. So we found that the campus SHAC's work on these assessments really gives us an opportunity to create some of these action item components on our agenda. The assessment also pushes schools to go beyond what they're currently doing. For example, one of our elementary schools wasn't going to qualify for the Bronze Award this past year, and so they are due to the fact that students weren't moving enough in the mornings. They were just coming to school, sitting in the gym or cafeteria. So they implemented Tabata Tuesdays, all because of this assessment and their desire to qualify for an award. So it serves as that initial motivator, and campuses find that it's really not often all that difficult to implement small changes that can yield some pretty big results. The assessment also helps us increase our participation in wellness initiatives because everybody wants award recognition for their campus. And there are also tremendous support resources available through the assessment and through the Alliance. For example, if you need to find a healthy alternative to cupcakes during classroom parties, through the assessment, there are resources that campuses can tap into to find one-pagers full of solutions to recommend instead of just saying no cupcakes, offering that one-pager of solutions. Next slide. So another cool thing our SHAC was able to accomplish this year is the purchase and installation of water bottle refill stations on every campus. So our SHAC can attribute this success primarily to the support of our district leadership and partnership with campus PTAs, but also to the toolkit offered by Salute America. Next slide. So our SHAC team strives to make the annual report to the board also more than just a show and tell. So we really see this as a success, that we take this opportunity to make our SHAC members feel that their voices are truly being heard. Throughout the year, we track data, monitor progress towards goals, and make that a part of this annual report. So this holds both our district and campus SHACs responsible for making progress towards our wellness goals while communicating hard data on the need for the Board of Trustees' continued support. Next slide, please. So the last success is our tremendous partnership with our Child Nutrition Department. So the SHAC and our Child Nutrition Department work really seamlessly together. We have members of their department present at every SHAC meeting. They donate snacks and refreshments for the group, not to mention the amazing things we work on together throughout the district. So some of those things include Chef Mario, our resident celebrity with the kids. He does taste tests and cooking demos throughout the year on all of our campuses. Their team provides nutrition education through various courses. They have a prominent presence at family fitness nights or student learning showcases that we have throughout the year. And actually, one of the pictures on the slide, through a SHAC request, we were able to convince our Child Nutrition Department to purchase a blender bike, which has been the highlight of the year for kids and adults alike. So we have that present at some of our events, and it just makes healthy more fun, which is always a perk. And then they also work to connect our school gardens with what kids are eating in the cafeteria and at home. Next slide. So like everyone, we experience some challenges year after year. So many of these are ongoing challenges, but one is geographic size. So it's difficult for us to stay connected, know what everyone's doing, get our resources and communications out to everyone. And we feel that the campus SHACs have really, really helped us with this because we have kind of little satellite district SHAC teams on each campus working to align their wellness goals with the campus need, which is key. Our partnerships with Child Nutrition, as well as the Alliance and other organizations, help maximize our reach and impact as well. So parent participation is always a challenge, but again, you'll notice a reoccurring theme with these campus SHACs. They really have helped in that area as well, because the campus SHAC chair, being a parent, has to report back to the district SHAC meetings as an expectation of their role. Collaboration with PTA has been key. As you know, PTA's impact is far-reaching, and they typically already have a built-in wellness champion on many of their campus PTAs in the Healthy Lifestyle Chair to utilize as a resource or potential campus SHAC chair as well. Administrative support, we found that it helps to make sure you're clearly communicating laws and policies. As we know, our administrators are very busy and sometimes they just don't know what the laws and policies are. So making sure those communication lines are clear and efficient. Also making attempts to align any of your wellness goals with their campus goals, which again, our campus SHACs have helped with. And then also getting the support of district administration to include campus SHAC and district SHAC information in some of the annual principal processes and the master calendar. And then lastly, communication. So we are constantly trying to reach more people, tell them about SHAC and how to get involved. And so we've had a prominent presence with, you know, the flyers and our website, but this year we focused in on social media because we're all very busy. And so it seems that quick messages out through Facebook or Twitter or Remind 101 have been a more effective mode of communication along with those other components. Next slide. All right, so some of our next steps as a SHAC we are bravely tackling sex education in the district next year and beginning the process of research and gathering best practices there. We're also taking a more focused look on our health education in the district. What direction are we headed? How can we increase health education? And what are the requirements and where are we addressing them specifically in Comal ISD? And then also always looking for ways to get students involved in the work that we're doing. So our future goal is to develop a kids SHAC, but we're going to begin with really pushing for student involvement at the campus level SHAC as well, and hope that that transitions into a district-wide campus SHAC. I mean, the K-SHAC, my apologies. All right. That is it.
Awesome. Thank you, McKaylee. And now we're going to hear from Samuel Carnes, who is the Assistant Director of Student Wellness at Spring Branch ISD. So go ahead, Samuel.
All right, thanks. So just echoing what McKaylee said, it's been awesome to be able to collaborate with other people just across the state, share best practices and learn. And as I told her prior to getting started with this, I was going to be taking some notes. So I really like the blender bike that they had in that towards the end of their slide presentation. So today, my hope is to figure out where everybody's at related to the school health advisory councils. I always tell people in the state of Texas, you're going to hear the SHAC acronym a lot, which is the School Health Advisory Council. And so hopefully today you will leave this webinar with a blueprint for building or developing a successful school health advisory counselor wherever you might be in your journey. Next slide, please. And we can skip that one too. Sorry, that's just the image for the blueprint, but I'm going to walk you guys through this. So earlier, you guys got an email that had the whole school, whole community, whole child, or for short, the WISC model, but it was blank. And I know that Michelle shared with me that a few of you were wondering, is that the way it's supposed to be? And so if you have that, I'd like you to pull that out and have that in front of you with a pen for this next slide. So if you can go to that next slide, Michelle. I want you to take that blank template and I would like you to label the 10 components as well as the yellow components. So I guess technically there's 11, but it's a 10 component model. And I'd like you guys to label as much as you know. And I'm running my clock because I'll make sure I stay within my 15 to 20 minutes here. So I'm gonna give you guys 60 seconds to go. And it's not a test, so don't worry, you won't fail if you don't get all of the components listed within this. You guys got about 20 seconds because I'm keeping my stopwatch here handy with my phone. Ten seconds. All right, and pencils down. We can go to the next slide. So hopefully your framework looks a little bit like this. So community on the yellow outside rings. Obviously, these 10 components surround what's in the middle of that. And again, that's going to be the focus of what I talk about on how we as a school district and Spring Branch ISD are supporting the whole child through the policies, the practices, and the implementation of what we're doing. So if we can go to the next slide. So I pulled this straight off of ASCD's website, but I always want to share this with folks. I've been in a variety of different conferences and listened to different people from different sectors talk, and I always find it interesting because we always ask that overarching question is how do we connect all of these great resources? And so here, I won't read this to you guys verbatim, but basically schools are an opportunity or a vehicle to deliver all of those things that we're trying to do for children. Next slide, please. So we share this same messaging on our website, and so I actually did just pull this straight off of our website so that when parents and community partners and whoever might be accessing our websites will realize where I've outlined or underlined, I guess, 3 major components within that, which is kind of similar to another body of work that we do some work around, which is Dr. Joyce Epstein, and that's kind of the spheres of influence, which involve the schools, the families, and the community. And again, as I shared on the last slide, schools are a great opportunity or a place, a platform to deliver coordinated school health, or formerly, or I guess more known now as the WISC model. Next slide, please. So I'm gonna ask you guys to pick up your pens again, and I'm gonna ask you guys with those components that you just filled in. Those are basic generic labels of components. And so if you go the, go to the next slide, please. I'm gonna give you an example. So for example, under physical education and physical activity, I gave you the first answer out of the, the 10 components there, but I want you to label within your framework that you have right now that should have some scratch work on it, who you think falls within each one of those categories. And I'm gonna put another 60 seconds on the clock and ask you guys to label in each one of those 10 components that you started filling out, who within the school or obviously with the community portion that you think fits into that. So 60 seconds. And if you don't have that template, you can snap a picture of that just so you have it. You can find it anywhere on the web, but go ahead and try to label what you know. Got 20 seconds. Staying tight on my time here. You go to the next slide, please. So this is who falls within each one of those categories in our district. I have a feeling that most of your districts, it's going to be very similar. Now, it might depend on if you have somebody designated for each one of those components. So for example, and Michaela hit on this earlier, that family engagement piece, we also definitely engage with our PTAs, our PTOs, the Healthy Lifestyles chairs, which we also did a presentation at It's Time Texas's summit recently with the Texas Healthy Lifestyles for Chair Representative, Karen Burnell. And so just give her a quick shout out. But our employee wellness, I'm gonna spend a little bit of time on each one of these components very briefly. So we call those health ambassadors, but at each campus we have somebody who serves as that champion for health for the employees themselves. And so with that being said, we meet with them 4 times out of the year, but we also ask them to sit on this campus school health advisory council, which again is kind of what McKaylee shared earlier in her presentation as well. We ask our folks to meet 6 times out of the year. And if you continue to look around those components, that's some interference here. Sorry about that. I don't know if that was me or not. If you notice and look around, I think you could probably identify different people in your campus that are very similar to this. So I did put a camera there. If you want to take a picture, you can. And so I'm going to ask Michelle if she can go to the next slide. So here, I kind of gave an overview. We do a lot of work. We had a parent who was serving on the Texas School Health Advisory Council. So you have that state level, the district level, which Michelle hit on earlier and talked about. Again, I mentioned the SHAC acronym that you're going to hear a lot of. So district is our District School Health Advisory Council. C is our campus. And we have 41 campuses, including pre-Ks that also have a SHAC. Their data collection is a little bit different, obviously at different levels from pre-K to the elementary, to the middle, to the high school. Policies and all of those things kind of vary a little bit. And then K-SHACs, we started several years ago. So that's a very older picture of when I was at a campus. We started the first K-SHAC, which is the Kids School Health Advisory Council, and it's been amazing to kind of see those grow, not just in our district, because I think we're up to about 10 campuses now that all have active SHACs at the kids level, but also seeing that grow across the state. Again, we share our resources and our ideas and our best practices because the goal is to spread health. Next slide, please. So I'm going to talk about a solution here for some of areas that you all might be looking to increase, strengthen, develop, all of the above. And so some of the recruiting that I just mentioned for the D-SHAC, the C-SHAC, we do pull our Healthy Lifestyles chairs, but we've started doing a lot more work with our community relations. We realized that a lot of partners, so we have an event called the Good Neighbors event, and we actually renamed it this year to State of the Schools, but it's where we celebrate our partners. And one of the things that we realized is we just weren't tapping into them related to the health and the wellness of kids and staff members. And so we started engaging in more conversations with our community relations department so that we could start bringing in partners to our D-SHAC to provide overview, but build and leverage off the strengths and the gifts that they do bring to the community. One of the things that we did to re-engage our district SHAC this year was we created a vision together. So I know that a lot of the policy is outlined. It even tells you about one of the subcommittees you should have, which is the physical activity subcommittee. But I realize, and I think many of us would agree here, you realize it's easy to tell people and have a monologue where this is what we're doing, this is the goal, but the buy-in isn't necessarily always there. And sometimes people don't necessarily see what that vision looks like, or they don't know the steps to get there. And then we want to talk a little bit about retaining the people that are on our SHACs, because again, it's very important that we have the voice of our communities, our families, to represent a lot of the decision and policy making and program recommendations that we do at the district level. Because again, we want our folks, all stakeholders, to be a part of that process. So again, we try to keep all of our communication very transparent, but it's a platform, and one of our core values in Spring Branch is collaborative spirit, which is why we highly engage with our community and our families. Next slide, please. So I won't spend too much time on this, but Michelle had mentioned this earlier, and I just wanted to highlight it is a requirement. Districts are only required to actually meet 4 times out of the year, and she kind of shared that the board usually appoints that. For us, we get appointed by our board, but we also have a board member who is a parent, but also sits on our D-SHAC, so that they can serve as a representative to share some of that information back with the Board of Trustees as well. So we've been very fortunate, and there's that percentage that we broke down earlier, but 51% family and community, and then 49% staff. I'd say realistically that number for families and communities is probably a little bit higher than 51% with our SHAC when I look at the meetings that we have. And then we have, like I said earlier, 5 times out of the year that we meet. So the 4 times allows us to talk about important topics, but the 5th one allows us to plan for, and I'll share a little bit here shortly on what we used our last meeting at the end of last year for. So if we go to the next slide, please. So the 5th meeting that we had last year, and I didn't put this in the slides, but we did do an exercise with our SHAC to kind of see where we fell. And that's related to the strengths and the weaknesses. And again, it's easy to celebrate the strengths. So what they really enjoyed about that was it's an opportunity for them to learn about different district policies, take it back to the home campus, because that's the purpose of having the D-SHAC and a representative from the C-SHAC, is to have somebody from C-SHAC come, typically a parent. Sometimes it's a staff member, to attend those meetings so that they can communicate that information back down at the campus level. They really felt like they had a strong voice, and it was a strong parent involvement that they felt connected to the district. Some of the weaknesses that we heard loud and clear, and we made we fixed or created solutions to those problems, was some of our subcommittees needed to be strengthened, focused too much on elementary, so it's allowed us to be a little bit more diverse in our thinking. Next slide, please. So I wanted to share what we currently do in Spring Branch. And again, I won't spend too much time because I've talked a little bit about this through some of the earlier slides. But our D-SHAC again meets, and so our goal is to have the D-SHAC communicate back to the C-SHAC, C-SHAC take it back to the campus level, so the boots on the ground that are in the campuses. And as I highlighted earlier, our pre-K centers do have those. Typically our C-SHAC chair, which we have 2 meetings out of the year, one in the fall and one in the spring, allows us to communicate the vision with what we're doing. And then again, we've been moving into the area of student voice and advocacy, and then communicating more with our healthy lifestyle chairs, where we do a SHAC 101 with those folks who might not necessarily know what the WISC model is and how we implement that in Spring Branch. Next slide, please. So you saw these earlier. These are some of the sheets we use. So I'm gonna have Michelle go through those just to be mindful of time, but that's just a roster. If we can go to the next one, that's who sits on the SHAC. We give this as a template to our folks to consider using for their meeting summaries, because we do ask all of this documentation to be turned in for each campus. And what we've done is we've created a Google Drive folder that has campuses and give them rights to upload that in there so that they can access that the next year, or if somebody moves or transitions, they still have access to all those pieces and they can review those notes. Next slide. This document's more internal for us, but we have an advanced movers initiative that I won't spend time on this one. But coordinated school health, anytime they're doing, like McKaylee said earlier, the 2 wellness nights or events, whether it's a family fitness fun night, it's a health fair, we ask them to kind of document this, because we want to know what our schools are doing so that we can create that report to go to our board as well. Next slide. This one we try to do to align with the campus improvement plan, and this is where you see a lot of the administrators have a huge interest in this, because again, we talked about healthy learner, or healthy kids equals healthy learners. And so if those foundational pieces aren't put in first, again, focusing on the whole child, the academics don't come. Next slide. Here's where we do individual goal setting for each one of those components. And again, I'm happy to share any of these documents later with people who might want access to those, but that's just for each component to create their goal for the upcoming school year. Next slide. So we also blended a lot of our things with the Alliance for a Healthier Generation. One of the things that I realized we do as a district, and we do it well, is we do a lot of data collection, but again, a lot of it's by hand. And just moving into the new era of technology, what I like is that their data that we utilize with them, it archives and it helps formulate action plans for our campuses as they complete the assessment to see where they are at for that year. And they do that typically September, October, and then the schools have throughout the year to work on that and earn these different levels of bronze, silver, and gold. And I'm excited. We have, I think, 16 campuses that are eligible for national awards this year. So we'll be excited to see what that looks like. Next slide. So here I wanted to just give a quick organizational flow chart so that you guys can see how we operate. It does seem very complex, but it's really not. So up above on the left, we have a coordinated school leadership team, which I'll dive into in a little bit on a later slide. We have the T-SHAC that I mentioned earlier, and if you look straight down vertically from the T-SHAC, you're going to see D-SHAC, C-SHAC, K-SHAC. So again, all those SHAC acronyms. In our area of Houston, we have the Greater Houston Harris County Public Health Group. So working a lot with our county and just coordinating a lot of the great programs and things and best practices of what they're doing. Branch out from our DSHAC, you see the PTA Healthy Lifestyle Shares, our subcommittees, which I'll focus more on shortly, and then our health ambassadors for employee wellness and our SHAC chairs. Next slide. So here, we really took this to heart this year. So again, I mentioned some of the strengths and weaknesses. We kind of fell where we were missing that vision. Again, there's policies that are set, but that's a generic vision. And so the weaknesses that we saw was a lot of confusion. And this is a document that can be found, which Michelle mentioned also earlier, with the Department of State Health Services as a SHAC guide, which is about 53 pages. And so you can pull this one out of there. It's kind of towards the back. Next slide. The other documents that you see here, we actually pulled from that same document, but it came at the right time for us. So our vision of the future, we asked our folks from the District School Health Advisory Council to kind of list their hopes and aspirations for our kids. And then we did it's almost like an empathy interview. We looked at creating a vision and what were some of the things that they liked about our schools, what were some things that they would want to change about our schools. And that's kind of how we formulated our goals within our subcommittees. Next slide. So here, again, I know that everybody has different backgrounds that's joining on this webinar, but one of the things that we do to support our district school health advisory councils, our campus school health advisory councils, is we have a district coordinated school health leadership team that's actually meeting today. So if you go back to that framework that's sitting in front of you with those 10 components, we have directors and coordinators from each one of those components. We meet monthly and we report to them what the SHAC is working on. So today I'm going to talk about how we're growing our student K-SHACs / swag group. And the hope is to create that district-wide with an event kicking off next month. So, but again, just an example of how we analyze and create game plans to best support our SHAC. So again, that's a coordinator or director from each one of those 10 components that you're looking at right now with the framework that you have in front of you. Next slide. So here, again, actually we can go to the next slide because that's just what each one of those does. And next slide. So I wanted to share with you what is next for SBISD, and I kind of gave you our overview of what we've done for the year. So back in November when we had our second meeting, we did our vision and goal setting to set us up for success for the 2018 spring going into that. And so again, we continue to work on streamlining the communication process with our community relations. We have a draft of a Google form, which is a series of questions that our end user, whether a community partner or whoever's wanting to do some work with our district, would fill that out. And it kind of is flagged on who needs to be included into that collaboration loop. So it's been really successful because a lot of times people will find an entry point into a district, but then not realize they need to talk to A, B, and C. We're also meeting with some of their bodies of work, which is the PI Partners in Education and the VAB, Volunteer Advisory Board. We are strengthening our collaboration through the development of our SHAC. So again, you do have those transitions, and so how do we develop those folks that are driving that, because they are some of the main drivers. And again, as Michaeli shared, you do have to have the administrative support as part of that process. Just recently, we started breaking into our subcommittees to create achievable short-term goals. And so one of the subcommittees that I just met with yesterday actually was the student advocacy group, which again, it's new. So none of these are set and says that you have to have these, but the physical activity is one you do have. But this is something that our parents and our families and our community wanted. And so we are developing our district-wide K-SHAC. I mentioned earlier, we have 9 campuses that have that. Excited about one of our high schools. All of those kids want to go into public health field, and we have about 100 kids at Memorial High School. And I'll make sure that Michelle has the link to their Weebly, which is kind of just the informational website about what they do and what they're doing. So that's exciting for us. Next goal. Next goal. Next slide. So here I just wanted to list out all the resources that we use. There's probably quite a few more resources that have been added since that time. So I'll make sure that I also include those into the notes. But ASCD is where I pulled the framework. Department of State Health Services is where I told you can get the SHAC guide on how to develop, how to create, and it kind of walks you through all the pieces that you need. TSHAC you want to stay up to date with because that's your policies that are happening at the state level and a lot of the legislation that's taking place. CDC, again, that's where they merged with ASCD back in 2014 with the Whole Child Initiative and the Coordinated School Health Model, which was birthed the WISC model. And then the Healthier Alliance for a Healthier Generation tool has been great. They have live advisors. I can't always get to our folks in a timely manner as much as I'd like to, and so this is a resource that we are also utilizing for our tool to collect the data. And then the last slide is just my contact information. If you guys have questions, follow us on Twitter. We are also doing a big push with social media to get stuff out to folks, and we're also using another tool for those of you with SHACs. Sign Up Genius is a great free online website tool that you can push out and create meeting events and kind of get RSVPs to find out how many people are going to be in attendance to your SHAC meetings. And what's really nice is they send out a generated email like 2 to 3 days before to remind folks again that you have a meeting coming up, and we hope that you're able to attend. And that's all I got for my presentation.
That's great, Samuel. Thank you so much. I think that was extremely helpful. Couple of questions that have come up. Well, before I do those, I do want to make sure that everyone understands. We talk about coordinated school health, and then we talk about the whole school, whole community, whole child model. And the WISC model is based on the coordinated school health model. Coordinated school health was the original 8-component model that was created through CDC that was expanded by the ASCD organization and CDC to focus more on families and community as separate entities, and just kind of broadens the focus and make it align more with what they felt would be appealing to administrators. Texas has a mandate that all schools K through 8 will implement coordinated school health. So you will continue to hear coordinated school health in Texas. We thought about going back to the legislature to try to modify that requirement, but we've had legislation the last couple of sessions that tried to get rid of coordinated school health. So there's concern that if we go back and try to change things, we're risking losing what we have since it's an unfunded mandate. So just so you know, everyone supports the whole school, whole community, whole child model of coordinated school health, and we'll continue to support that. One of the questions was about you use on your PowerPoint, I think, Samuel, you had a leadership team and you had subcommittees. Are those the same, or are those two different things? You mentioned your leadership team meets monthly.
Yes. So those are two different things. The subcommittees are comprised of people from staff, people from the community, the families. So for example, for my student advocacy subcommittee that was just created based off the feedback that we got this year, those are all parents that are sitting on that. But then our nutrition one, for example, and we'll have to find, our district dietitian is just left a couple weeks from us ago. So that one actually is 2 community partners, the Oliver Foundation and HEB's nutritionist / community partner liaison is serving on that committee until we find a chair, which is hopefully from the school. And then we have an SEL subcommittee, which again is comprised of district folks as well as families, community partners, people who are experts and licensed in counseling. And then the coordinated school leadership team is actually all staff. And so, for example, the family engagement, we have a coordinator who was hired specifically to increase family engagement. We have someone from the community relations office for the community involvement piece that comes to share. We have for health services, we have a lead nurse or a coordinator who comes to that meeting for the counseling services, obviously is our director for counseling. We also have community and schools, which is kind of like a social worker. And so we also have them come in because they do a lot of counseling pieces related to that. We have employee wellness, which is our department, but also employee benefits. They also come to that meeting as well. And again, it breaks us out of silos so that we can actually have conversations about the things that we're learning from our parents and our community through the SHAC. But obviously the SHAC can't just make decisions or executive decisions that would impact the entire district. And so we take a lot of this feedback and we share that with our coordinated school health leadership. So for example, today, our coordinated school health leadership team will be meeting, and I shared this before the webinar got going, but we're looking at a social emotional learning tool to measure that at each one of our campuses. And so she actually told me at a meeting last week, I need to meet so-and-so, I need to go meet with this person, I need to go meet with this person. And I said, no. You just need to come to our meeting today, and then you're gonna hit all of those people that you just listed. And so that's kind of the direction with the coordinated school health leadership team, which is, again, two different things. No families on that one. That's kind of what the district school health advisory council serves as, to create that platform and voice. But again, they are part of our subcommittees because we look through one lens, but they also look through 3 to 4 different lenses as well.
This question was for both of you. Talk about a typical School Health Advisory Council meeting agenda. I mean, I think both of you probably approach it a little bit differently, but Michaela, you want to go first on that?
Sure. So we always start with district updates and share outs. So each representative from the district level of each of the subcommittee areas shares out what's been happening in the district. Then we give an opportunity for our campuses to share out. And then the remainder of the meeting is really focused on whatever topics we're working on, for that time period. So whether it's the Alliance assessment or a specific topic of work that we're addressing, is really takes up the remainder of the time.
So I'll just add a couple pieces to that. So our DSHAC meetings, we actually offer 2. We offer a 9 to 11 and a 5 to 7, so kind of reverse hours. Some people are able to make the morning session and some people aren't. So we do try to accommodate that as much as possible. I do use the Sign Up Genius because if nobody signs up for the PM session, I also don't want to stay from 5 to 7. But we've had a pretty good showing of 7 to 8 people that come to the evening session, and it's been really productive. Ours is very similar to Michaela's. Our subcommittees actually report out in the middle of it. We do kind of a welcome, a check-in, and introduction just real briefly, but we also have name tags that people keep. And then it just kind of depends on what we're focused on. So we obviously always start with celebrations. And then we talk a lot about programming because that's one of the things as a SHAC that you have to do. We did change our format because we used to invite partners to come in and we would actually vet them. But one of the things our SHAC said that they would like us to do is not do that so much because they would like to trust that the district is doing that, but they do still want the information related to that. So I give a lot of updates on programming. So for example, we did a program called Kids Teaching Kids, and that's where our culinary kids created these healthy snack recipes. It was through a partnership that they actually vetted last year. So we did report that back out to them. I do try to throw in brain boosters because 2 hours is a long time to sit. So I build that into the presentation. And then, like I said, those worksheets that you saw earlier, we led them through some tangible exercises where they were actually writing these things down, table talk with your partner, kind of like educating kids, so to speak. And we walk them through a lot of those pieces, and then we give our updates to the subcommittees. We list out the upcoming dates and just remind them that we to use the Sign Up Genius to register for the next meeting. And I can share an agenda with you if you'd like, Michelle, and I'm sure Michaela can as well. If they want a sample of that, I can send you one because I just pulled that up from one that we did earlier.
That might be helpful.
This year.
Great. How do you communicate with the school board and the school district? I think Samuel mentioned you have a school board member on your SHAC. How else do y'all communicate with the board and the district? Samuel, go for it.
Oh, okay.
Sorry.
So as you shared, we do have a board person that sits on our SHAC, but one of the things that we do is provide kind of these reports. A lot of it is end of year because you have to provide some of the reports and share out the data. So that is something that is kind of required that we do. But we work through our senior staff. So like that coordinated school health leadership team, all of those people have a pretty high authority or high position within the district. And so they are creating that conversation in the platforms of where they're at. And that's definitely an area that we're encouraging to strengthen. It's one thing for us who talk very extravagantly about coordinated school health and the WISC model because we live and we breathe that and we're passionate about it. But it's about encouraging our senior staff that sit on that coordinated school health leadership to be having those same conversations in the areas of influence that they have. And so we have seen some growth in a lot of that, especially through the ESSA funding. So the Every Student Succeeds Act, we are talking with our executive director for our area of who oversees us and he's having that conversation with the Title I coordinator to ensure that we are represented well through that.
What about you, McKaylee?
Yeah, I agree with what he said. We also have a board member representative that comes to some of our SHAC meetings, and so that's extremely helpful, as well as working through senior leadership and really focusing on making the most of the opportunity that we have through the end of year annual report.
Okay. Y'all work with subcommittees. Are all of your subcommittees active all the time, or do you have some that, you know, come and go? I know, and as Samuel mentioned, there is a state mandate that you have an active physical activity subcommittee for your SHAC. So that's something all SHACs should have all the time. But what about the others? McKaylee?
So subcommittees is a definite area of growth for our SHAC. Our focus has really been in implementing and strengthening the campus SHAC groups. So that is an area that admittedly we need to do better on. But yeah, we really have utilized just our campus SHAC chairs and the strength that they provide with the work that they're doing on their campus.
Perfect.
And I would just chime in that this is an area that, again, was shared as an area of growth for us last year. And so we've really ramped it up this year. So we have a nutrition committee that I mentioned earlier. We have an SEL subcommittee, and we are doing a lot of our work through Google Docs. So what I've created is a public file location for all the things we're doing related to SHAC, because by law, you also have to post your notes online. And because our web design is getting updated, hopefully to a better one, we've been storing ours on a Google Drive so that people have access to all of those documents year round. Our SEL subcommittee has met a few times already. I think it really just depends on the work of the subcommittee, but I can tell you for a fact for our subcommittees, they will be busy this year because we had them go through that vision. We also borrowed a document from, I say stole, but Baker Harrell at It's Time Texas. We borrowed his change maker template, which is basically 5 questions. What is your vision? How do you create that change? Who do you need to recruit? And then celebrating kind of the wins. And so that's what we're doing through the process right now with our folks. And so what I've asked each subcommittee chair to do, which is also on a Google Doc, and I've highlighted them so that the people know who the actual chair is I've asked them to meet within the next 2 weeks and be ready to report out at the April meeting. But I also am trying to work with them to beefing up a little bit the presentation that's shared, because some people are a little bit nervous to talk in front of big groups. And so, again, that's just one of the areas of work that we've really hammered down on for this year. But I would say tip-wise, you don't want to just create a subcommittee for the sake of creating a subcommittee. And that's why we kind of did a poll of what people were wanting. And we created our subcommittees based off of the input that came from our SHAC, because they're going to be the biggest ones that help us drive that. And that's where we created this new student advocacy committee. And we're going to be doing a district-wide SHAC, and I'm going to be leaning on those parents very heavily to help me drive that.
Okay, expanding a little bit on your communication with the school board, what do you do if you're wanting to make a recommendation to the school board? What is your process that you go through if you're trying to recommend something for change, whether it's sex ed or recess? How does that work? McKaylee, you want
Sure. So we first make sure that we have, crossed all our T's and dotted all of our I's on the back end. So making sure that we have collected data, done our research so that we can clearly communicate the need. And then we work it into through our senior leadership through our annual report. So all recommendations come with data analysis reports, and we make sure that we have sufficient amount of parent participation in the process, so that, like I said, we can just make sure that we have done all of our work on the back end so that the recommendation is clear, it's strongly supported with evidence, that it is a district need, that's what's best for kids, and then we use our annual report for the time to work that in as an action item.
And our process would be very similar. Obviously, TASB kind of released a new template last year, so we pull a lot of that template, format a lot of the things to fit within that. But the wellness plan was an area where school districts had a lot of opportunity and flexibility to write out what your actual goals were. And so our goal, obviously, it's hard. I think in any school district, there's a timeline, which isn't necessarily always the most convenient timeline. I think it's hard because there's a lot of things that they have to navigate through. So it's kind of challenging in some aspects, because if you miss the deadline to get something submitted, it's a little bit harder to get it pushed through. But I would say, again, leaning heavily on the coordinated growth leadership team, you might have presented and maybe you don't get another opportunity, but if you're working with another component within that same framework that you guys have in front of you, they can also advocate on your behalf, because a lot of times we see that there's overlap and some shared common goals on what we're trying to do, especially related or revolved around social emotional learning, which would include more physical activity, physical education, quality health and PE. So a lot of common goals where multiple people are asking for it. But again, as McKaylee said, it does go through the process of getting your request in to maybe share, speak out, present it, and then make sure that you have it in for the revisions when they look at the policy updates that go onto the webpage.
Awesome. How did you get the SHACs started in your district?
So we worked it into our wellness policy. So when that was approved, it initiated the campus SHAC requirement for all of our campuses. And then just really communicating with principals the why behind doing that. And we have just continued to grow from year to year. Certainly year one, not all campuses had a campus SHAC, and even this being year two, we're still at about 98% of our campuses with a campus SHAC. But year after year, as principals and administration start to understand the importance and the benefit of having a campus group in charge of wellness on their campus, has been beneficial.
Great.
So a lot of our campus SHACs, and I can't take the credit here. A lot of it was established when I transitioned into this role. My goal is just to continue to help drive that. But I know Catch curriculum had, and I can't remember the name of it, but it was like a Catch team. So a lot of it got started through the health fitness teachers. So a lot of our SHAC chairs, we do have a couple parents, especially at the secondary level, where some of these health fitness teachers or coaches or nurses are heavily inundated with more things because they have more kids on the campus. But it did start through mostly our health fitness teachers, but also as a shared vision has been passed along with some of our nurses. A lot of times it's just finding who's going to be that champion. And what's really nice is there's so many tools out now that are available. So it's not like, hey, I need you to do this, and then you start from scratch. It's, hey, I really would appreciate you taking this into consideration. I know that you're very passionate about the health and the wellness of every child, and just, again, finding that advocate to serve in that role. I can say one of the things that, and I don't know if McKaylee would agree, one of the things that we are finding a challenge is we don't pay these folks. And so that is something that I am putting into a proposal through ESSA, the Every Student Succeeds Act, to figure out if we can have a piece of that pie so that we can cut them a small stipend similar to what like a team leader gets. Because I think, as someone once told me, volunteer is great. It will take you so far. But it does help to compensate them, especially if we're asking them to have 6 meetings out of the year at their campus, attend 2 of our meetings. If they're the health ambassador at their campus as well, they're wearing multiple hats, which, again, many of us do. So I am putting that into a recommendation to where we would be able to get some funding to provide them with a stipend. And then lastly, I think with the national award, having 16 schools eligible, my hope is that each one of those campuses completes the application. I know from the district level, we are providing the evidence that we can to make that a little bit easier for them. But I think principals pay attention to the things of where people are getting celebrated. So it's one thing to celebrate the small victories of what you accomplished, but I think that builds the momentum. And when people begin to see that and their spotlight on that, that encourages more campuses and principals to say, hey, they got national recognition, they got invited out to this big event, everything was paid for, and it starts the conversation stirring, I think.
Awesome. You guys have been great. I think there's some wonderful information for our SHACs that are working out there. A reminder, this will be posted. We will send a link to the recording as soon as we get it up on YouTube, as well as the slides and any resource materials like the agenda that Samuel is going to send me as well. So we are at the end of our time. I had one question about if campus SHACs are common practice in other districts. I think a lot of districts use wellness teams, SHACs, they call them different names, but I believe that a lot of the districts do have catch teams or wellness teams or SHACs at their campus level to help with implementing wellness plans. So I think it's common practice. It just they may not all be called by the same name. We do have another webinar, the final one for this school year in March on social emotional learning. We have a couple of presenters from Harvard who have reviewed different curriculum around SEL, and we'll be sharing that resource for you, as well as Austin ISD, who has been working with school health advisory councils in the surrounding area to help them get their SEL programs up and running. So join us in March for that webinar. In the meantime, visit Action for Healthy Kids website for additional resources, and have a great spring. Thank you all.
Thanks for hosting us.
Thanks.
Thank you.